Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we'll be talking about what is sore tongue. But before we continue, make sure to hit the subscribe button down below to encourage me to do more and more videos. So let's start now. So we have different causes behind sore tongue. We will discuss each in details. Number one is trauma. That is the most common cause behind a sore tongue. Biting your tongue or drinking or eating something sharp, it will cause a sore tongue at the end because you are causing a trauma to your tongue. A sudden trauma to your tongue will result in sore tongue at the end. So this habit, that is the tongue biting, you need to avoid it as much as possible so that you won't end up having a sore tongue. Number two is transient lingual papillitis. Let's separate the words. Papillitis is inflammation of the papilla, in which you will have a white or red spot that will appear on the tongue, and the causes are maybe due to stress or maybe due to hormonal changes that is commonly seen among the female ladies. It is transient, so it is of short term, not of long term. Here is a picture for a transient lingual papillitis that might cause a sore tongue for you, which is inflammation of the papilla of the tongue. Number three, oral thrush, which is also referred to as candidiasis, which is a type of fungal or yeast infection that can affect your mouth. Here is a picture for the thrush in which you will have a white coat on your dorsal surface of the tongue. This is referred to as the oral thrush or oral candidiasis, which is a fungal or yeast infection. Oral thrush is more commonly seen in infants less than 1 month of age, older adults, people who wear dentures continuously day and night, not washing it. These are more prone to oral thrush. In addition to that, those with a weakened immune system, people with HIV, people who have recently taken antibiotics. Why is that? Because excessive use of antibiotics will weaken your immune system, which will lead to oral thrush at the end. Those who use steroid inhalers to manage their asthma, so asthmatic patients also are prone to oral thrush if they do not take care of their oral cavity by brushing their tongue. Lastly, people who smoke, because we said that the oral thrush, the cause behind it is a fungal or yeast infection. So people who smoke are more prone to oral thrush. So they need to brush their dorsal surface of the tongue while they brush their teeth. Not only their teeth, they need to brush their tongue in order to not develop candidiasis or oral thrush. So this is regarding the denture wearers. Note that when you take your denture off, you need to wash it and clean it well. You need to brush it as if you are brushing your own teeth. You need to brush it as if you are brushing your own teeth with a toothbrush. And also you need to place it in salt water. Okay, only a salt water, no need for chlorhexidine. Avoid chlorhexidine because it has an abrasive action. It can affect the mucosa of the denture. So therefore, I prefer for you to just place it in a salt water rinse and keep it for 24 hours for the next day until you use it. But very important, when you take your denture off, you need to brush it as if you are brushing your teeth. Lastly, a very common cause, mouth ulcers. Tongue biting can result in mouth ulcer. Stress can also lead. Drinking hot things suddenly can also lead to mouth ulcer. So mouth ulcers are a very common cause behind a sore tongue. They will naturally disappear by itself within 7 to 14 days, or within 7 to 10 days, they will disappear by itself without treatment. If you are in pain, I recommend for you to just gargle with salt water And you can also avoid drinking hot things and apply cold things. Always try to eat ice cream, to eat cold things, or you can place an ice as well, ice cube on the ulcer. Also, all these natural remedies that are available in your house or your home can reduce your symptoms. Doctor, I have a sore tongue. What can I do now? I will recommend for you to use a soft toothbrush to brush your teeth, brush your tongue, or use a scraper to help improve a white tongue in case of candidiasis or oral thrush. Use a straw to drink cold or cool drinks. And if you are in severe pain, you cannot tolerate it, I recommend for you to take paracetamol or ibuprofen for pain management. Thank you all for watching my video. If you have any questions, please do write it down in the comment section below. Goodbye now.